use music therapy because the research shows phenomenal outcomes. It even amazes us at times. We build a theory of what might be useful for the children and then pursue to research possible outcomes. And in every case, we found the outcomes far exceeded our expectations. The research shows that infants thrive under conditions of music to reduce stress or pain or some of the other side effects of the medical treatment that keeps them alive, which I think is one of the most exciting issues, that it's a very economical therapy with phenomenal benefits and almost no side effects. And you begin to wonder, why wouldn't you use music therapy in a NICU?
You can see when the therapists come in and they start playing their guitars and singing to the babies and holding them, providing that developmental touch. If you just look at the monitor, you'll see their heart rates come down, their oxygen stabilize. It really makes a big difference.
You know, the greatest benefits of the music therapy program has been multifactorial. First of all, for our patients, which is the primary focus, it actually does two things for these small, critically ill and vulnerable babies. It provides much needed stimulation, just like any baby would need, for their brain development. But another added benefit for them has been in their vital signs and their stability. We know when mothers are holding their babies, they do better. Their heart rate is more stable, their temperatures are better, they feed better. But music therapy also provides some of that when the mothers can't be there to be with the babies. So it's been great for them from a two-pronged approach. It also benefits our families. The best thing that it has helped with the families is to help keep them calm. You know, it's one of the most stressful things for a parent to go through when they come to the NICU with their child. They're out of control, they want to do everything for their baby, but yet they feel like they can't do much. And when they come to visit their baby, it's very distracting with monitors and alarms and equipment, and they don't focus on their baby as much. So music therapy has been able to come in and allow them to avoid the distractions of the NICU, focus more on the baby, and remain calmer. And they also see their baby being calmer. So for families, it's also been beneficial.
As a mom in the NICU, music therapy made a huge difference for me to be able to feel bonded to the girls. I remember sitting there just participating in the music therapy, listening to the guitar, being able to stroke my babies and hold them and help them relax, and the music therapy made a big difference with that.
I think the most interesting thing I've ever done in my career was tackle the problem of helping babies become independent feeders after they were born premature. A baby's neurological system is too immature for feeding by mouth until 34 gestational weeks. That's about 3 or 4 weeks before the baby usually goes home from the hospital. Prior to that time, if the baby is born earlier than 34 gestational weeks, they have to be fed by tube. So that could mean if a baby was born at 24 weeks, it's had 10 weeks of tube feeding where it has not tasted food, it has not sucked. So there is no sucking reflex at the time you try to teach the baby to breastfeed or formula feed. So we created what we now call the PAL, the Pacifier Activated Lullaby device, and that device gives contingent music reinforcement for a suck. And what we found out immediately was in 15 minutes we could teach a baby to suck just by giving them a pacifier that contingently played music. We were astonished to find out it transferred to the very next feeding. So we spent 15 minutes teaching the baby to suck. The next time the nurses tried to feed the baby with a bottle or the mother tried to breastfeed, the baby started sucking and feeding. And within 24 hours was able to be discharged from the hospital. I mean, it happened so quickly, it was breathtaking.
Because we have music therapy on a long-term basis, we are now going to be able to implement slowly, cautiously, but using music therapy in the very high-risk, critically ill population of babies and see if that helps to get them off of the mechanical ventilation faster, see if it helps to prevent brain bleeding, those kinds of things.
We've been working with one of the physicians here who asked us, is there anything we could do for babies who were on the ventilator for a long period of time? So we gave reinforcement for each independent breath and played 10 seconds of music every time the baby breathed on their own. And within 30 minutes, we taught babies to breathe on their own, which again was absolutely astonishing. But obviously, music is pleasurable to babies. They would not change their behavior or work to receive music if it wasn't. And what a wonderful thing to give pleasure to babies undergoing intensive medical care at such a fragile age.
It's amazing. I never would have thought that this program would have been this helpful with my twins. They're walking, they're talking, they're learning sign language. You would never be able to tell that they were born 2 pounds and 3 pounds, and at 31 weeks, they're doing great.
The relationship of Florida State University's music program with the NICU has gone on for decades, and they have been a great partner for us in the neonatal intensive care unit over 20 years in early research before many other NICUs were doing this. So I'm proud to have them as a partner, to be asking good questions to us and getting involved in our care, and now providing a great educational resource to our music therapy staff and provide care to our patients. So they've been a vital partner.